Hello, everyone. Um, Welcome to our webinar. I see a number of you have joined already. Can I have just one person confirming that I am audible?
Yes, you are, Doc.
All right. All right, I think we can get started now. So good evening, everyone, and very warm welcome to this important webinar today on gut health in reproductive, maternal, newborn, child, and adolescent health, a nutritionist perspective. That is the title on the poster that you saw. My name is Dr. Bonke Arunga. I am honored to be your moderator today. I am the convener for Social Responsibility and Welfare Committee at Kenya Medical Association. Before we begin, I want to sincerely thank our main sponsors, the Kenya Medical Association and KEPRECON. They have supported this event and made it possible. They are dedicated to championing evidence-based advocacy and improving health outcomes across Kenya. And I think this is truly inspiring. KEPRECON particularly promotes pediatric research, care training, and mentorship for better health of children, both in the urban and rural communities. So if you are interested in something like that, you can visit their website. It is keprecon.org. So today we are privileged to have Eunice Nthea, a nutritionist and wellness specialist. She will share her insights on the vital role of gut health from pregnancy and infancy to adolescent. I think this topic is crucial for us because gut health profoundly impacts immunity, nutrition, and overall well-being, especially in the vulnerable populations like mothers and children that we take care of every day. So a little bit about our presenter. She is an experienced and certified nutritionist. She's been working for close to 10 years in nutrition. She holds a degree in food and nutrition and dietetics from Kenyatta University and has dedicated her career to helping individuals transform their health through informed nutritional choices and sustainable life changes. So throughout her career, she has impacted over 5,000 individuals, has been guiding them through a healthy and more balanced lifestyle. Her approach is deeply rooted in behavior change, focusing on equipping individuals with the right knowledge, habits, and motivation for long-term wellness. She is also passionate about preventive nutrition, weight management, disease prevention, and holistic well-being, which ensures that her clients adopt sustainable health solutions tailored to their unique needs. So, whether through personalized nutrition coaching, group programs, or public health initiatives, nutrition led by Nthea, as her company is called, continues to champion for evidence-based nutrition strategies that empower individuals and help them take charge of their health. I encourage you to stay engaged throughout the webinar. Please feel free to submit your questions via the chat box. We will have a Q&A session towards the end to address them. This session should last about 1 hour, 30 minutes. So we'll have relatively 1 hour for presentation and then 30 minutes for your questions. So without further ado, let me invite our presenter to take us through our presentation. I will be on the background unless something comes up until we finish. So Eunice, the floor is yours. Take it away.
Thank you so much for having me. Good evening. By just a show of hands, let's make sure that my internet is okay and that you can see me. Good. Thank you so much. I'm really honored to do this presentation. I know the bio says, excuse me, the bio says I have been doing this for 10 years, but I must insist that this is my first presentation to this caliber. I do a lot of presentations weekly, but this particular one gave me a lot of excitement. And I sincerely thank you all for inviting me. Now, I just need to make a slight correction to the name. I know Daktari really butchered my name, but my name is Ndenya. I am a certified nutritionist, as mentioned. I am a mom and a wife. According to the time I'm home, so there's a lot of activity going on. My son at times really likes to come in and just say hi. So you'll actually allow me to accommodate him, but that should not be a bother. So allow me to share my presentation. But before I do that, I'd just like to remind you that this is my presentation, and it actually goes to just show my perspective. I know you have another perspective, so it is for us to agree to disagree in a very good way. Gut health is very broad, and as I was preparing, I was like, where should I lean towards? So I chose to lean towards what I've been doing the entire year. 7 months in, and I have just been talking about gut health. I have seen a lot of improvement in my clients, especially those that have been trying to lose weight for a very long time, and also bringing into the side of children and a lot of mothers who are currently pregnant. So this is what I have for you today. In case my internet misbehaves or there's any issue, Daktari, kindly let me know. So I'd just like to start with a few facts that I have been sharing over the past few months with my clients. And I know you're not clients, but allow me to treat you as some of my clients today, because that way I'm able to relate with you. When I started really going into the in-depth of the gut side, my own experience was I really just wanted to understand, what is this thing that the father of medicine said is the beginning of all diseases. The other thing was because of a personal experience, which we are not going to share today, but I must insist that I was actually I keep getting a lot of information on gut health that I never got in school. So every single day I'm reading something new to do with gut health. I'm seeing new studies to do with gut health. But one of the most exciting thing for me is I actually could sit and say that my body is more bacteria than it is cells. And all of you can confirm with that. The other thing that has actually just been really mesmerizing me over the past 7 months as I talk about this thing that we carry and never think about it as much unless it brings a small problem like bloating or constipation, is that the term that your gut is actually the second brain, for me, now where I stand, I can actually prove that for sure we have that enteric nervous system that actually communicates to the brain. So when they actually say you trust your gut, you should trust your gut. So I'm hoping that when we continue, you'll actually be seeing the connection, especially with the nutrition side. And it pains me to know that just one meal or one day of a bad diet, including a lot of ultra-processed foods, a lot of sugars, a lot of processed food, then in those 24 hours, if you've been building your gut health, it could actually be destroyed in just that one meal. But then it also gives me assurance that the gut is one of the fastest healing part of the body. In 3 to 5 days, if you're nourishing your gut properly, then you could actually regenerate the gut lining, which is very important. The integrity of the gut lining is something we will talk about throughout the course of this presentation. Now, I will just quote the father of medicine again and say, all diseases begin in the gut. But then there's something else that I want to quote, is that death sits in the bowels and bad digestion is the root of all evil. Now, that is a statement we can talk about the entire evening, but I'll just say this. The studies that have been coming across and just what I know now, dealing with a lot of people, I have dealt with over close to 10,000 individuals since I started this, but this particular year, I have been able to deal with over 500 people just dealing with gut issues, and I'm seeing for sure a lot of things, a lot of bad is coming from just bad digestion. And yeah, so gut microbiome is at the center of this. We cannot talk about the gut and not talk about these microorganisms that we carry that are so unique to each and every one of us. Each body carrying between 30 to 100 trillion in a single human. As we know, our bodies are roughly 30 trillion cells. So you can see we actually have a ratio of 10:1. Some studies or some people are saying that it's like the ratio is reducing. I don't know if our current habits and lifestyle are actually affecting that, but I hope and trust that after this session, we will be able to try and as much as possible multiply this microbiome to actually be as much as possible, because we are going to see how they impact not just ourselves, but the people that we come across every single day. But the bit I like is that our microbiome is actually very different for each person. It's like a unique thing that we all carry. Now, there are different types of the bacteria, but I just chose this particular image to show you different types of the bacteria can actually impact different functions of the gut. Now, we all know the functions of the gut, from digestion to nutrient absorption, but then we are also going to go into depth of thinking about things like immunity, seeing that above 70% of our immunity is actually built in the gut. 90% of the serotonin, which is responsible for your sleep and feel-good hormones, is actually also made in the gut. So different bacteria are actually coming into play for different things. Like, for example, you'd see some are very good for the production of pro-inflammatory cytokines, very good for anti-inflammatory effect. Then you'll see nutrient absorption is a different type of bacteria. Then you're also seeing other types of bacteria will now inhibit. There's the inhibition of production of pro-inflammatory cytokines, but then on the other side, there are other bacteria that actually now inhibit the inflammation. Other types of the bacteria that we have, some of these words is very difficult for me to pronounce, I must admit, but you'll bear with me. So we would also see that some bacteria actually protect our bodies against pathogen colonization. So different bacteria are going to play different roles. What I like with the bacteria is that there is no single bacteria that is playing the same role. They play different roles, and most importantly is that we need to understand as we are starting, is that this bacteria that we actually really want to protect at this particular point is that they also have their rhythm. The way we have our rhythm, I look at the bacteria like a garden. If you feed them, they thrive. If you don't feed them, they die. If you allow them to sleep, they sleep. So they even also have a circadian rhythm. So I keep asking myself nowadays, if gut bacteria can have a circadian rhythm, who am I? Who am I not to appreciate that during the day I should be active and during the night I should actually go to rest? So the most important thing about this, I didn't want to go into the in-depth of explaining the gut and all, because I know most of you or all of you actually understand that, but I wanted to pick it up from the dysbiosis, because this cuts across the entire group that we are talking about, the reproductive, maternal, newborn child, and adolescent. That is the category that we are dwelling on today for the gut health. But I needed to look for a middle ground, and for sure, when your gut is imbalanced, there is no way across the categories that I've mentioned, there is no way your body is going to be whole. So I really needed to talk about the dysbiosis, basically just talking about the imbalance of the gut bacteria. We always say it should be an 85 to 15%, 85 being the good bacteria, 15 being the bad bacteria. And our environment and our practices are actually now really causing a serious gut imbalance. So the imbalance is not just coming to affect the digestion or the nutrient absorption, and now you get things like malnutrition. No, it's cutting across from kids getting dental issues, or even adults, to skin issues, to gut issues, which are common: constipation, hemorrhoids, bloating, gas, things like H. pylori. It is also moving to things like immunity. So very low immunities, especially in kids and also adults. Adults, I'm seeing that on my side. People are getting flus every 2 weeks, every other week. And also a case that we cannot not talk about. Mental health issues. All this is connected. Now, new studies are showing that lifestyle diseases like type 2 diabetes and also autoimmune conditions are actually linked to an imbalanced gut. So dysbiosis secondary to insulin resistance and low grade chronic inflammation is actually showing to be caused by gut imbalance. Now, a lot of you might ask, how does this happen? I just wanted the simplest explanation. Leaky gut, having a leaky gut is one of the things that we really need to go into depth today. So basically, is that your gut is leaking contents from the gut to the bloodstream. So that triggers inflammation. The inflammation now actually impairs insulin function, leads to insulin resistance, and then now your inflammation becomes worse. And that's where we would say now we are going back to lifestyle diseases and other things like skin issues. So I really wanted us to just have a look, a small reminder of how our stomach lining, the inner, looks like, with special mention to the mucosa and the submucosa. A lot of the practices that we are seeing, consumption of a lot of alcohol, consumption of a lot of ultra-processed food, consumption of a lot of sugar, a lot of gluten, is actually showing to erode the mucosa. That is one of the biggest problems that we are having. So if the mucosa is eroded, then the integrity of the gut is compromised. So we are trying as much as possible. Everything we do is to actually restore the integrity of the mucosa, the integrity of the gut lining, specifically targeting the mucosa. So anything that is coming to disrupt, anything that is coming to mess up with the mucosa is what we are trying to stay away from. And raising their hand. Daktari, kindly confirm.
I think it's big right now. Okay.
Okay. Thank you. Sorry about that. We'll just do it slowly as we go. I hope we are back now. Now, let's quickly just look at what happens in the case of a leaky gut. So on one side, we have a normal gut. I hope you can see this image. And what is happening is that on the normal gut, the junctions are tightly together, okay? But on the side of the leaky gut is that we are having faulty tight, it's like there are gaps inside the junctions. So a lot of the issues we are seeing, especially this is in relation to type 2 diabetes, insulin resistance, autoimmune conditions, is that zonulin is actually present, is higher for people with a leaky gut, which is now going to in turn be higher in people who have these other conditions I've talked about, obesity, type 2 diabetes. And that's why we now need to restore the integrity and make sure that our guts are normal. So there are a lot of things that are really causing the leaky gut, but one of them that I must make a special mention to that we have overlooked is gluten. Now, about 10, 15 years ago, the gluten-free diet started coming into play, and a lot of people just thought, oh, this is just another thing that people want to ride on. But a lot of studies are now showing that gluten is one of the things that actually causes faulty tight junctions. So I want you to take key note of that, because unfortunately, as we are going to see, we are seeing a lot of even the children with neurodevelopmental issues, differences like ASD, actually, when the zonulin test is done, you actually find that it's actually higher for them. So I have just given a brief description of the main things that I'd really want to talk about during this session. We'll go into the different categories and what I have experienced in my 10 years of close to 10 years of experience, and what we are currently doing at the end to actually ensure that we are helping these categories to make sure that their gut health is good. So when I look at the reproductive age, these are women who are very energetic fast, they are sexually active, and because I am in this field, these women are always trying to manage their weight. Either they want to gain weight, either they want to lose weight. But the other thing that is common for them is that they have a menstrual cycle. So every 28 to 35 days, every other month, there's a cycle. So we are having a lot of hormonal imbalances, quote unquote, because most of the time when people out here say hormonal imbalance, they've not even tested for what hormone they are actually that is not balanced. But I'm seeing a lot of estrogen dominance, mainly women coming with irregular periods, and they come even when they don't know. So they'll just say it by the way, oh, by the way, my periods disappeared 4 months ago, or I've been mid-spotting, I'm finding like I'm gaining weight on the lower part of the body. But when we look into the in-depth of their diet, then you find that they are consuming a lot of processed food, maybe because they seem to be very busy with their work, and at the end of the day, they don't have time to either work out or getting a proper meal. So they end up consuming a lot of processed food. They're ending up consuming a lot of sugary drinks to stay alert because they are not getting enough sleep. And that is really causing a lot of imbalance in their gut. So this poor gut health is actually studies are showing that it leads to systemic inflammation, of course, and hormonal imbalance. But the main thing for the gut is that when your gut is imbalanced, when, for example, you're experiencing constipation, you're not even able to pass out the estrogen. So there's a specific microbiome that supports estrogen metabolism and what we call the estrobolome. So when these women are having a poor gut, these women are experiencing this inflammation, then there's a very high risk of fertility. Of course, it's happening for both men and women, but I'm seeing this happening a lot for women. I have been dealing with women with PCOS ever since I started this job. My first clients were actually women with PCOS, but what I'm seeing is that when we integrate them into our gut cleanses, when we are teaching them about the gut and just telling them this is what you can do, this is what you can change, taking the focus from balancing hormones and actually working on their gut, I have seen several conceive. Actually, some are conceiving even when they are not trying. So for the fertility issue, we need to see the in-depth of it. Let's not just look at the hormonal imbalance. Are we looking at the gut health? Are we even taking time to ask these women? Sometimes they don't say the truth, but when they come to a nutritionist, after a session or two or the third, they actually find themselves saying, okay, yes, I'm meal prepping, but because of pressure at work, because of this and that, I'm not able to eat that food. So I find myself overindulging. This category of women also are exposed to contraceptives, and I don't want to say there's a direct impact on their gut health, but if we are seeing some of them having some of these issues. I don't have quite the study to prove for this, but I'm seeing a lot of the women on the hormonal contraceptives having more issues to do with their gut as opposed to the others. Unfortunately, they also have other factors contributing to that, so we cannot really put it on the contraceptives, but I'm here to say, let's make sure that we are listening to these women just beyond the imbalance. What is really causing it? Yes, they have ED. Yes, it's because their progesterone is low, but how is their diet looking like specifically for their gut health? Are they even consuming a diverse category of fiber, or they're just eating the same type of food every day? These particular women are also really at a high risk of urinary tract infections. And I see this commonly when they finish an antibiotic course. So a healthy vagina and gut microbiome are actually mostly interrelated. A lot of the time, when I find a client with a UTI, I always like to ask, what other symptom have you been experiencing? And most of the time, I'm finding they either have issues to do with bloating and gas and constipation. And when we start dealing with that alongside the medication and the treatment, I am seeing clients doing a lot of improvement and not getting the recurrent infections as before. Now, something to note is that when we do a gut cleanse or a gut session with a client, of course, we are also targeting insulin resistance. So that could be the reason why they are getting the results. So gut health is that you cannot pinpoint on one thing working. It has to be a multidisciplinary approach, because we send them to the therapist for their mental health, and then we are sending them to work out, and then we do the nutrition, and the doctor is doing their work. But most commonly, the ones who are not taking a probiotic or even introducing home probiotics or fermented foods after, we are seeing an increase in the UTIs. The same category I mentioned is very prone to wanting to maintain their weight from January to January. And I'm seeing when we take the focus off the weight loss program and concentrate on healthy habits for the gut, then they're managing their cravings and actually losing a healthy weight. I'm having cases of these people actually losing more than I anticipated. Last month, I had 2 who lost 7 and 12 kgs respectively. And these people were on proper calories. And the only thing they changed was their diet. The only thing they did was the gut cleanse. Some of them I had requested to stop the gym so that we see what was happening. And for sure, if we introduce good gut practices, I am seeing a lot of the changes, including weight, which is common for the women in the reproductive age. Now, with the women in the reproductive age, if they don't start taking care of their gut health in advance, fertility is compromised or affected. But we are also seeing that when a mother conceives, the maternal conditions, the maternal gut health is actually highly affecting the infant gut microbiome. And I want us to connect this to all the way when these children go back to being adolescent. So let's forget about the reproductive age and just pick this from here, from the intrauterine to when these people are adolescents. So if for the past 10 years I've been in this industry, I am seeing the same trend. A mother, the way the cycle would be, a mother gets pregnant because they are very busy with work. They are not able to actually eat properly, so they are eating almost the same food. And then this mother, because of sitting down a lot, at the end of the 9 months, the mode of delivery might be affected. And then these mothers, because they have to rush back to work, the mode of feeding for the children is almost the same. So it moves from a busy mother to a pregnancy where they are not feeding very well, so they are consuming a lot of ultra-processed foods, and then mode of delivery becomes cesarean, and mode of feeding, instead of exclusive breastfeeding, because they need to go back to their busy jobs, they are now choosing to formula feed. Now, there are also other environmental exposures that maybe the mother is not in control of, but because of the obese mother who in return has all these problems, then we are seeing the problems starting from delivery. I'm not saying we put the blame on the mother, but I'm saying if we actually need to pass nutrition education to the mother, it now needs to move from just you're eating healthy for the baby to grow. We need to communicate the message from you're eating healthy because your gut health matters, and your gut health will impact you, your child, today and even when they are an adult. Because when this child is born and the mother was overweight, you get a bigger baby. And then by the time we are even talking and working on this child, they are already an adolescent, they have mental health issues, and then they give birth, they get to the reproductive age and give birth to an unhealthy baby. So it's a cycle. I would say it's a cycle, and all it actually starts here from the mother. So the attention that we are giving to the maternity, we need to make sure that we are communicating. The mode of delivery is actually highly going to impact your child's gut health. Studies are showing vaginal deliveries, the children have better gut microbiome. We need to communicate very well, which is, I'm seeing a lot of people communicating nowadays, social media spaces, that what the mother is putting on their skin could affect. I get very sad when I see a mother who's pregnant and they are spraying themselves all over, and those are toxins. I don't know if we are communicating that, because that in entire. So my main focus would be if we can make the communication as much as possible for the mother during ANC clinics. That would be a very good starting point, because now we pick it from the beginning. The 9 months of pregnancy, your immunity is already suppressed. So if we are very keen, if there's a way we can introduce probiotics and good gut practices during the pregnancy, then we will help these women boost their immunity and help them reduce infections, which will in return reduce their consumption of over-the-counter medication. Sometimes these women don't tell you, or they don't come to the hospital direct, but sometimes they just go and buy medication over the counter. Some don't even mention that they are actually pregnant. I met one, I had a session about 2-3 weeks ago, and one just told me she's on antibiotics and she's 8 weeks pregnant, and she did not mention. So maybe because she did not know the extent of the damage to herself and to the child. At that particular point, if we are very keen on communicating the message and communicating and making sure these people are on prebiotics, taking enough fiber, doing enough movement, and getting enough sleep, then we work on their gut health, which will in return really help us come and work on things like gestational diabetes, preeclampsia, and excessive weight gain during pregnancy, secondary to insulin resistance and inflammation. Now, this has actually been very recurring in my practice. I'm seeing a lot of women being sent by their doctors to look for a nutritionist. They are gaining too much weight. We are having people gain 20 to 30 kgs. And of course, at this particular point, they are at risk of gestational diabetes, preeclampsia, and other postpartum related issues. I would say this, if we go back again and work on the gut health, it will help these mothers, and it will even come through for the postpartum depression. Because, for example, if the mother gains so much weight during the pregnancy, there is a likelihood. Sorry, I'm seeing. Okay. Thank you. So we are seeing if this mother gains a lot of weight during pregnancy, there's a likelihood her mood and postpartum depression might go up during post-delivery. So if we mitigate this earlier, then we are going to have less of these cases. When we move to the newborn, of course, after the mother has delivered, I decided to put the newborn and the children together. Of course, newborn meaning the ones below 28 days, and the children, the other category. The newborns do not have a responsibility at this particular point, but we are the ones, as the doctors, as the practitioners, and as the parents, we're the ones who are laying the foundation for these people. Their immunity and digestion actually relies on us. So if we communicate this during the visits, if we communicate and say, okay, this is why, we're not just telling them you can have any form of delivery. Of course, every mother can choose, but we really need to pass the message, because if the gut microbiome is actually trained from the word go, by the time they finish the 28 days and now we help them build with breastfeeding between 0 to 3 years, then we will not have a lot of issues to do with gut health. Unfortunately, a lot of the studies that are coming post any time between 2013 and now, 2013, 2015 and now, are actually linking some of the things we'd never want to link to gut health. Colic, allergies, eczema, to an imbalanced gut. But the most interesting one that I'm coming across is that up to 70% of children with ASD actually have gut-related issues. Now, this is my thinking. We're just going back to that image. Is this coming from the mother's gut? If a study was to be done and following a mother's gut health all the way from pregnancy to delivery, and they are followed to 3 years, are we going to see the same numbers of the ASD children? We really care about the immunity for the under 2. The immunity is still developing. If we can be sure to try as much as possible to reduce processed foods when we introduce complementary feeding, that will go a long way. After 3 years, then now we can introduce other things like probiotics, because after 3 years, these children, their immunity is actually like that of an adult. Another thing I need to mention about children is that if we need to take care of their cavities and their teeth and their dental health, then it starts from that. If we are taking care of their gut health, there's going to be a less occurrence of the especially cavities. But if we are giving them a lot of sugar, a lot of processed foods, then the visits to the dentist will actually just be more than they have been now. This is a special category of people that I think sometimes we forget about them, because once they stop being children and they are not yet adults, they are there in between, and we don't talk about them a lot. And I'm happy a program like this one is giving them the chance. But adolescents, to me, when I meet them, and the ones that I've come across, is that I'm seeing a lot of them who, it's not that they don't have the information to do with health, but they have just, because of the transition, because of not understanding, and maybe because of not getting very good role models, activity to them is not a big deal. They will just eat because they don't put a lot of thought to what they are eating. Now, unfortunately, I think the KDHS report had reported about the increasing mental issues in the adolescents. That was the 2023-2024. And if we are keen on this, we will notice that most of the time, it could also be because of the dysbiosis. You see, these kids are either spending too much time sitting on their screens, most of them, especially in the urban areas. We are seeing a lower microbial diversity, and unfortunately, that's affecting their appetite. Then they eat more, and then they sit. That affects their mental health. Unfortunately, as we mentioned before, is that 90% of the serotonin is actually it could be linked to low fiber and high sugar. If anyone has dealt with this category, they would tell you that this is very common. I see them leaving school, the adolescents leaving school, and it's on a regular day. The parents or themselves are getting ice creams on a regular Monday, and then you'll see the same child on Wednesday, and maybe because parents are not very involved. So if we communicate the same to parents, or if we also communicate to them in a better way that they can understand using the channels they relate with, TikTok is a channel I think they're really relating with, so that can be used to also communicate. The consumption of processed food with limited movement is actually showing to affect their health. And that's why we are having an increase in childhood obesity. Where I sit, I do telehealth, and I see a lot of women or a lot of mothers coming to me, and it's sad to see a 10-year-old who is at 130 kgs. I don't know how we got there. But then there are studies that show that gut health is better for people who are in the rural areas. Is it because they move more? Is it because they are eating more whole foods? Can we try and see? Can we try and study? Because the study I saw was actually Burkina Faso and London, and the Burkina Faso families, the children there had very good gut microbiome. So if we try as much as possible to introduce them to food like that, the food that we ate with our mothers, what we grew up knowing, maybe it could change things. Maybe, just maybe. So what's the way forward? Because I've really talked about gut health, and I just wanted to cut across those numbers and those categories, sorry. And what is common to most of all these people is that over-the-counter use of medication is actually happening. Either over-the-counter or just misuse of medication. When people visit the hospital and they just tell the doctor, I want this particular type of medicine. Like, for example, how do we justify that people are taking antibiotics for a flu, which is viral? So antibiotics, NSAIDs, PPIs, all these are actually really impacting our gut health. Remember we going back to that image that I showed, when we do away with the mucosa and the gut lining integrity is compromised, it is going to take a long time to actually work on it. Yes, I say the gut lining can regenerate in 3 to 5 days, but when there's overuse of this medication, either because the doctor is constantly giving you the same, or they are doing it over the counter, then we might have to take a lot of work to actually reverse it. I have seen that, for example, people who come to me with IBS, people who come with a bad gut, it might take 6 weeks to 6 months to actually fully get their gut to be okay. Yes, the 3 days there will be a good show, but then for a proper gut overhaul, it takes about 6 months. That will mean you're really doing away with the processed foods. You're really doing away with things like processed foods, food additives that are a lot in the kids' foods. We are doing away with a lot of alcohol consumption, doing away with inflammatory foods. Specifically, if we can take time to do away with the processed seed oils or the seed oils and introducing anti-inflammatory foods, eating your avocados, eating your berries, making sure you're eating 20 to 30 different types of fibers every single week, not just 1 week, every single week, making sure that we are practicing proper hygiene without over-sanitization, because over-sanitization is also a problem, especially in the urban area. Also making sure that we are introducing fermented foods, pre and probiotics. Prebiotics including things like onions, and it's not just the cooked onions. If we can find ways of eating them raw, like the pickled ones, making sure that we are taking the fermented foods from sauerkraut to kimchi in moderation, to miso, the kombucha, kefir, which is one of the best probiotics there is. Then we start introducing it for mothers who are pregnant, and then we introduce the same for children after 3 years all the way to adolescent and reproductive years, then we could actually help to curb the issues that we've been talking about. Proper hygiene, just as mentioned, but not over sanitizing. I see people sometimes using soap to wash fruits, and I think it's too much because that's, again, introducing substances that are not supposed to be coming to the gut. Soap should be properly washed, and fruits don't need to be washed with soap. A simple wash with vinegar and water can work. We need to also encourage activity, and especially just walking. 30 minutes walk every single day, 5 out of 7 days a week is going to show and has been showing an improvement on the gut. And specifically making sure that we are talking about sleep. I know sometimes as doctors, you don't have the time to remind a client to sleep, but that could be all they need, because just like we said, the gut bacteria has what we call the gut circadian rhythm. So there are some gut bacteria sleeping responsible for sleep and also resting than the very active ones during the day. So if we are not confusing them, and the worst thing without sleeping is that you always find people eating when it's not time to eat. So the time they're eating, the bacteria is asleep. Sorry about that. I see the internet had misbehaved for a minute. Then I actually highly encourage talking or introduction of gut microbiome health in ANC, as mentioned, and also for neonatal children and adolescents. Those were my references. Thank you so much. And I think Daktari can let me know if there are more questions that I can answer.
All right. Thank you so much, Eunice, for your presentation. Sorry, I butchered your name earlier. I'll try to train about it before I mention it here. Before we had this session a few days ago, I had sent some online forms for people to ask questions, and I got quite a number. And I've seen there are also questions in the chat box. So I think we can answer a few of them. We still have about 30 minutes for Q&A. If you have questions on the chat, please let me know. I will ask them on your behalf. But we have a number of questions here, so maybe you'll take the first one. So one of the things that we have talked about is the widespread use of antibiotics. And one person was wondering that, considering the widespread use of antibiotics in hospitals and communities across the country, so how does that antibiotic overuse affect gut microbiota in mothers and children? And in your opinion, what do you think are the strategies that healthcare providers can use to mitigate the negative impacts while treating infections? All right, so maybe you can go ahead with that, or you want me to read all of them first?
No, I think I can take two at a time.
All right, so the second question is about access. One person was saying that in rural Kenya, access to diverse and nutrient foods can be limited, especially with differences in socioeconomic statuses. So what are some of the affordable, locally available dietary options that can support gut health, especially in pregnant women and young children? What recommendations do you have, particularly in the period of weaning, after exclusive breastfeeding for 6 months? Thereafter, what options are available and what would you recommend? So that's the second question.
Okay, so thank you so much for the questions. So I'll start with the one on antibiotic use. You know, when a test is already done and the client or the patient, now I need to change that. When the patient is supposed to be put on an antibiotic course, most of the time what I've seen is that most clients will go home without a probiotic. So yes, they'll be on the antibiotic for 5 to 7 days or 3 to 7 days. And after that, because you see what happens is that the antibiotic is going to clear both good and bad bacteria. So with that, my recommendation, and what we are seeing working for the nutrition side is that a probiotic would work post the antibiotic use. So after the 7th day, it would be very good for them to consume any probiotic with 50 billion CFUs and above. That would suffice. That would help restore the gut bacteria. That would be the recommendation. The idea is not to stop the antibiotic use, because I mean, if the bacteria needs to be killed, there's no way I can do it from this side. But the recommendation would be let them get a probiotic course after the 7 days. The other thing would be also speaking to them about consuming probiotics at home, the ones that I've mentioned, kombucha, kefir, yogurt here and there. Not very keen about yogurt because there's a lot of processed yogurt in the market. But sauerkraut, something someone can make at home, is also going to come through. Then in the rural Kenya, I would actually say the rural area is better placed when it comes to gut health. This is why, like the study I mentioned for Burkina Faso and London. And by the way, I'm going to share with you the studies that I used for this. The chapter was too big. I didn't know where to lie. So I'm going to make sure that I share some of these studies with the team that reached out to me. So the people in the rural area are actually better placed. Their gut bacteria has been showing to be more diverse as opposed to those in the urban. For weaning cases, especially when mothers are weaning, it is best to start with what is available and build into the family routine. If the family eats meat once a week, then that is where the child will get the meat. With the gut health, you would actually find people in the rural area, because of being able to get different types of variety. So like, for example, they can get cabbage, they can get kienyeji vegetables, they can get carrots, they can get eggplant. Let's not look for the very expensive. Let's go for what is there. Because, for example, the anthocyanins that are in the eggplant are the same you could get from the blueberries that we would be chasing. So the rural area should not be an excuse. Actually, they are better placed than the ones in the urban area. The urban area, you'd find they have to wait for food. It's not as fresh as the ones in the rural area. Someone in the rural area can actually just get spinach and cook it directly. For me, I have to wait for it to be brought from Nyandarua and so forth. So for the rural area, that should not be a problem. With weaning, let them start with what is available as per the family menu. This idea of changing that there is baby food and adult food is where we are going wrong. If you're feeding your family on legumes, let the baby start on the same, just slow but sure. If there is meat, let it be introduced at the correct time, as per the family menu, without feeling like they have to carry the baby in a special way, so that as long as the baby is being incorporated into this family, it's just the same. But people in the rural area, there's better diversity than people in the urban area, for sure.
All right, thank you so much for that. We can pick some questions from the chat. I see Patrick is inquiring about the published data. I know you've mentioned about that. So just everyone knows, this is a recorded session. I think at the end of this, it will be published on YouTube. So under the description of that video on YouTube, you will get the list of references that our presenter is asking about. If she has them, she can post them, but if she doesn't have them right now, we can put them under the video on YouTube. You will check them on that side. There is a member here, Dr. Nora, is asking, from a clinical perspective, I'd love to understand more about the gut cleanse approach. What intervention do you typically use? Is it supplement-based, dietary, or both? And then the second question is from Dr. Melissa, is asking, good presentation. Wish you could highlight do's and don'ts of specific conditions, examples, eczema, allergies, and colic in terms of dietary changes. And maybe we can take a third one from Dr. Walter. Would you please comment on 2FL and 3GL in infant formulas, forms of oligosaccharides and probiotics? I think there are still more questions coming in, but you can answer those three.
Okay. Allow me to start with the one from Dr. Nora. Now, when I kept referring to a gut cleanse that I've been running, it's basically we do not use any supplements. We actually just use nutrition education, teaching what has been affecting your gut versus what you need to do. So it's combining the question from Dr. Melissa as well. Think yes. So the do's, what we do is we have 3 categories, or rather we've divided it into 3 sessions, 2 weeks of elimination. So we are eliminating anything that causes inflammation, starting with dairy, gluten, sugar, and any processed food. So for 2 weeks, we completely eliminate that. And what basically we are teaching these people is include whole foods as much as possible. Remove those cubes that people use for cooking, introduction of healthy cooking oils as well for the first 2 weeks. And then the other 2 weeks is we are making sure that they are introducing probiotics, mainly not the pharmacy probiotics. We want to teach people to be able to use what they have at home, as simple as something like sauerkraut, which is just fermented cabbage. You just need salt and water and cabbage. So we teach them how to use the fermented cabbage. Someone can get kimchi, kombucha, which is fermented tea you can make at home, and kefir. With kefir, you can just buy grains and make at home. So that is the second aspect of the challenge. So the cleanse is basically teaching, or we've seen clients are not, I'm not saying they're not able to do it on their own, but we are walking the journey with them, making sure that 2 weeks they try and eliminate. And by the 2nd week, like now I have one that is already on the 3rd week. And by the 2nd week, bloating, constipation, a lot of acidity issues are actually gone. Then the third part of the challenge is now reintroducing some of the ultra-processed foods. Like now, ugali would not be in the first 4 weeks. We would introduce it in the 5th week. So that's what we are doing. So we are not doing any supplements. We are just trying to use as whole foods as possible. But for people who are in regions where they cannot be able to come into access of the processed, the very complex probiotics like kombucha, because they don't have the SCOBY or they don't have the kefir, then we are advocating for use of the probiotics. I use as simple as something like Floranom. I know it's a brand name, but that's one of the things that we've been using. Simple, but the Saccharomyces has been coming through. Now, I would like to also make a comment on, I'd like to, so Sahiba, the SCOBY can be bought, or you can get a friend to help you actually get it. But most importantly is you can make it yourself. You can get the kombucha from the supermarket, the one that doesn't have sugar, the raw form, and make it yourself. You just need to be patient for 2 weeks, and the SCOBY is going to form. Allow me to make a comment on the question from Walter Ogada. Now, allow me to say this, is that I have sidelined myself to not communicate about formulas because at some point we were, as the medical fraternity, especially the nutrition bit, we were really not following up on the formulas. So I haven't gone into in-depth reading on the same, but I would say anything that is coming with a probiotic for the kids would be a better choice. I have not been in that space for some time, so allow me to not comment on the same so that I don't say anything that is not in line. I have been dealing with adults for 10 years. I forgot a bit about the newborns. Now, there's someone who's asking about peptic ulcer disease and management of H. pylori and the gut microbiome. From my experience, El Matata, from the current experience that we are seeing, having done 4 gut cleanses this year, I am here to report that we are actually getting positive feedback. This is someone comes in with H. pylori. We do 6 to 12 weeks of the gut cleanse, what I've just explained, and even some coming with the PUD. And after the 6 and 12 weeks, we are getting people who have stopped taking PPIs. We've gotten people who've stopped, who've gone back and even checked, and the H. pylori is not present. I have clients who, I actually have one particular client who came to me who could not even take water. They were not even able to take water. And by the 6th week, this lady was not taking any PPI. So what we are seeing is that it is just a case of first taking time to understand how is this thing happening. Then introducing the proper food. Processed food is bad for the gut. If you take it away, some of these issues are actually resolving. Most of the time, because of the over-reliance of the medication, we never take time to sit back to see what is happening when you introduce just proper food. So that's what I'm seeing. The treatment, in as much as I like that there's probiotic, there's the PPI, but I really hope and wish all of us could be recommending a probiotic course as well. Because taking the kit for 2 weeks, that is really not good for the gut. I've answered the question on the SCOBY. There are people who just give the SCOBY away. Look in your circle, you'll find someone with it. Muslim, I basically do telehealth, so I don't have a physical location, but the team is going to share my number if that is allowed. So allow me to take it back to you, Daktari,
All right.
in case you have more questions.
Yeah, those were wonderfully explained. Thank you so much. There are 2 more questions on the chat. There is an anonymous attendee who is asking that does a mother's diet affect her baby during breastfeeding in terms of my dad or meals, e.g. beans, making the baby uncomfortable afterward? All right. Then there is another person, Dr. Eric. In cases for infants, we can try to give them Floranome sachets or enterogermina in cases of non-malabsorptive syndromes. It is phrased as a statement, and I think it's a question. All right, maybe you can comment on that.
So kindly come up with the second one. Is it a question or a comment?
I think it's phrased as a statement. So in cases for infants with the non-malabsorptive syndromes, we can try to give Floranome sachets, enterogermina, for those cases.
Yes, I actually agree with that, and I've seen improvement on the same. Yes, so allow me to answer the other question.
All right, go ahead.
Yes, Doctor, kindly come up with the other question. I think something
it was
I wanted to share something that I've been doing for a client of mine, and yeah, that skipped. Sorry about that.
There's a question
The other
about
question,
mother
yes.
and baby.
Yes.
So does diet affect the baby during breastfeeding, especially meals like beans? Do they make the baby uncomfortable afterward? I think that has been because there's a lot of online misconceptions about the cause of colic in babies during breastfeeding. I think that is relevant. And then there is another question from Dr. Michael Jami. What is the role of yogurt as a probiotic?
Good. So I'd like to say what the mother takes actually could affect the child in terms of the gas and all. And I like to just give this example. There's a reason why breastfeeding moms do not take alcohol. So the same way, very small bits of what the mother takes is passed through the milk. But we always say if the mother's gut health is good and you've done the proper soaking of beans and all, it might not actually affect the child. So the bit is there's just a small correlation. It's not very direct, but it's the same thing that whatever the mother consumes is actually being passed to the child. But we've seen colic could be an issue with the gut of the child. I think I've seen a lot of the children now being given things like BioGaia and Enterogermina, and the colic resolves. It just depends with who you're seeing, but in communication with the pediatricians that I've spoken to is that there are specific foods for sure that will cause gas to the child that have been consumed by the mother. Interestingly, I didn't know this, but also tea. I tried it with some of my patients, and I've seen the mothers who stop taking tea with tea leaves, the colic actually also reduces. So it's not just beans. It's beans, other legumes when they are not soaked, and things like tea as well, tea leaves. It also depends from child to child. That's what I would say. To Dr. Michael, I would say this. Natural yogurt is the least form of probiotic that I can personally recommend, especially the store-bought one. The amount of probiotic in it is so minimal that sometimes now I'm telling my clients to just do away with it and look for other probiotics. But if that's the only probiotic you can get, yes, remember the one that is natural. Don't go for anything that is flavored, because the sugar actually just reverses the probiotic effect. So I would say yogurt is just the least form of, it has the least CFUs. If you compare yogurt to something like Kifa that is now really coming up in the Kenyan market, Kifa has over 10 times of the probiotic quality as opposed to the yogurt. So yogurt can be used for the person who's not able to actually get the access to Kifa. But if you look at it, then Kifa production is more affordable than yogurt. You can make Kifa from your home. You just need a tablespoon of the grains.
All right. Thank you for that. I think the one last question that is pending, I'm not seeing any other, is someone wanting to know the relationship between gut health and non-communicable disease. So the question is framed as with the rising burden of non-communicable disease and changes in lifestyle in Kenya, especially in the urban areas, what is your comment on non-communicable disease? Have you observed any shifts in gut health? And are there any studies that are local to our setup that you can reference?
So unfortunately, this one I will not say there's any study that I've seen locally for the same. I would need to go back and just look for more or any. But from my experience, what I'm seeing in practice is that, as mentioned earlier, leaky gut is our biggest problem. So we have two issues that are arising from the leaky gut. It's low-grade chronic inflammation and insulin resistance. All the diet-related non-communicable diseases have one thing in common: IR. So that is what I'm seeing currently. And that's why I made the pointer on under the reproductive, is that women in this reproductive age really want to lose their weight because they are either overweight or obese. And this is to BMI standards, when we come to the waist and hip ratio, we are actually finding that not very many people are on the heavier side as we think. So what we are seeing is that once we start working on the gut health, we seal the junctions that I was talking about in the leaky gut by eliminating things like gluten, sugar, dairy, processed foods. Then we are having more of them move from the overweight to the normal weight or the healthy weight. But that takes time. That would be the relation. Have I seen any study? No, I have not looked for any study locally for the same. But I have reviewed some studies from away from home that are showing the relationship.
All
Yes,
right.
Dr. That would be it from
Thank
me.
you so much. I'm not seeing any other question. I don't know if you have any parting shot, last words before we conclude.
No, I would say it's been a pleasure sharing what I've seen from my experience here in my practice for close to 10 years. Thank you for having me. Looking forward to hearing from you once you review the studies that I would have shared once the video is up, and looking forward to future interactions. Thank you for having me.
Thank you so much, Eunice. This has been eye-opening. We have had a lot of key takeaways. We need to limit the antibiotic use unnecessarily, and we give probiotics if we have to, and encourage healthy diets. I think this is important for our healthcare professionals. It gives us practical ways to at least start the journey for nutritional health, even before we refer for nutritional consult. So this has been very enlightening. Like I mentioned, the video will be posted on YouTube, and we will have to post all the studies that have been referenced here. I also want to extend my heartfelt thanks to all of the participants for joining today. I think we peaked at around 140, which is quite impressive. We have had engaging questions and answers with interesting comments. And also a special thank you to Kenya Medical Association for organizing this and KEPRECON. If you are interested in child health and maternal health, you can check KEPRECON on their website at keprecon.org. So please do stay connected with KMA, and these events are occurring every other day, every week. So stay tuned for more educational events and initiatives. I don't know if the president is in the meeting. If he's here, he can greet us and say something. Let me just check if he's around. Mr. President, are you around? All right, I am not seeing him here. Thank you so much for attending, and have a good night, all of you. You can log out at your own pleasure.